Welcome back. Today we'll be talking about the science of death investigation. First, what is death investigation? It is a formal inquiry to determine the manner, cause, and mechanism of death. So who investigates death? In a coroner system, we have an elected or appointed public official. They may or may not be a physician. The role is administrative and investigative, often relying on forensic pathologists for autopsies. Or you can have a medical examiner system. These are typically appointed physicians with an MD or DO. They're often board certified forensic pathologists. They perform autopsies and scientifically determine the cause and manner of death. So in a coroner system, this is going to be administrative. They're kind of like just the director, so they're kind of a manager. They kind of oversee it. They may not be the ones actually performing the autopsies, but they'll be signing off on the death certificate. For the medical examiner, there's a pathologist who will actually be performing the autopsy and going through signing off on the final cause and manner of death. Some pillars of determination. First off, we have the manner of death. This is going to be the legal classification of death, which is typically homicide, suicide, accidental, natural, or determined. We have cause of death, which is going to be the specific injury or disease that leads to death, like gunshot wound, heart attack, and your mechanism of death. This is going to be the physiological derangement produced by the cause. So sanguination, cardiac arrhythmia. So what actually caused you to death? Like what actually physically happened in the body for death? So bleeding out, like sanguination, or your heart stopping. Some manners of death, including homicide. This is going to be the death at the hands of another. The investigation of this nature is going to focus on evidence of intent, weapon, and suspect identification. Then we have suicide. This is a death caused by one's hand. The investigation seeks to rule out foul play, establish intent, and confirm the self-inflicted mechanism. Then we have accidental. This is going to be death from an unintentional act or unforeseen event. The investigation is going to focus on the circumstances. So like an overdose, fall, motor vehicle accident. We have natural. This is a death due to illness or natural aging. The investigation confirms medical history and absence of trauma or foul play. And the rare one is going to be undetermined. There's insufficient evidence to classify the death into one or the other categories. This is going to be typically when there's a long exposure. So if you find skeletonized remains that you cannot clearly identify any type of trauma. So there's no broken bones. If it was soft tissue damage that caused, that's going to decay away, decompose away, and they're not going to have the evidence that we need to determine the manner of death. So his role of forensic death investigation in criminal justice. The medical legal death investigation provides the objective scientific foundation upon which the criminal justice builds its case. The investigative process includes forensic analysis, which is going to be your investigation, which is going to combine scene findings with scientific analysis from autopsy and the lab. Toxicology, these screen for drugs, alcohol, and poisons. Histology, your microscopic examination of tissues. And DNA and serology, analysis of blood and other fluids. And then finally, ballistics and tool marks, matching weapons to wounds and things like that. I'll dive into my specialty, toxicology. Toxicology is important in medical medicine, emergency medicine, forensics, and the public health. It has roles in emergency medicine for the rapid identification of poisons. It can be vital for the patient's survival. Immediate action can prevent severe health outcomes. And then once the severe outcomes have happened, we start the forensic analysis. So the toxicologists are going to analyze biological fluids for drugs and toxins, and the findings are going to support legal investigations and case resolutions. So we have our initial role, which is going to be trying to save the patient. And then we have our forensics, so they may be digging into what happened after the fact. And then the overall, kind of the 30,000 foot view of the overall impact on public health. This is going to monitor environmental exposures for communities and then respond to outbreaks of poisonings to protect public safety. So this includes drug epidemics, exposure for toxins in the environment, things of that nature. So some core concepts are going to include pharmacology, metabolism, and then analytical detection. So the first part is going to be pharmacology, which is going to be focused on the mechanism and the effects of toxins and drugs. So this is going to explore how drugs and toxins interact with the body. We focus on the mechanisms of action and their physiological impact, so the impairment or the toxic attributes. Then we have our metabolism, which is going to be focusing on breakdown and elimination. It's going to examine how the substances are processed by the body. It's going to predict duration and the effects based on metabolic pathways. So how long it stays in the body, and how long impairment is, or how long toxic effects are there, and then how the body breaks that down to remove the toxins from the body. Analytical detection. It's identification and measurement. This is going to be ensuring the accurate detection of agents in patient systems, so that when we have a measurement, reliable measurement for the full system. It's going to be to identify and measure the quantitative measurement of how much drugs are in the system. It's going to be important for investigations for drugs of impairment. So what the conditions were when the person died, were they impaired? Was the drug concentration high enough for death? Or toxins, so poisons. Was there a toxin effect enough to have an impact on the cause of death or something of that nature? So we have a two-step process in toxicology. We start off with our screening. So the screening is going to be the initial test. So typically, you have rapid screenings. It's going to be your first line of action in clinical toxicology. These help detect drugs or toxins in biological samples. These are important in emergency sample settings. They provide immediate preliminary information to clinical clinicians to guide urgent medical decisions, often urine drugs. And the main purpose of these screenings is to deliver quick, qualitative or semi-quantitative results. It's going to identify the specific drug classes. These results are important to understand that these results are presumptive. So it indicates a positive or negative presence. It's not determined, it's not intended to be a definitive diagnosis. So we need confirmation testing. This is only to give an idea that there most likely is something in the system. So our two-step approach, we have our initial screening. It's going to be a presumptive test. These are fast and cost-effective methods. They detect a wide range of compounds. And immunoassay are commonly used. They are highly sensitive, but they can yield false positives. We have a confirmatory test. This is going to allow for accurate identification. These are used after a positive screening result. Employ specific and sensitive techniques. Methods include gas chromatography and high-performance liquid. They provide precise identification and quantification. First, let's dive into a little bit of immunoassay. Immunoassay relies on the antigen-antibody specificity. These antibodies are tailored to recognize a specific drug or metabolite. And detection is based on this binding interaction. An antigen is the drug, or the metabolite is a sample, and the sample contains a substance to be detected, and these antibodies bind to those antigens. It is a competitive assay. So what that means is we have our labeled drug. We have in the bottom of the well we have our antigen binding site, antibody binding site, and then we add labeled drug in a low concentration. Now, if there is real drug or drug in the sample when we add it, it's going to outcompete the labeled drug and have less fluorescence. So the labeled drug is used for detection, and this enables the measurement of binding. It's an inverse relationship. So the more drug there is in the sample, the less color there's going to be. So less fluorescence there will be because the labeled drug will fail to be outcompeted with the binding sites, and they'll get washed away. So the color will not be there when there's a high drug concentration. If there's no low or no drug concentration in the sample, then there will be a high fluorescent color, and there will be a high number. So a low number indicates more positivity. So some types of immunoassays include enzyme-linked immunosorbent assay, or ELISA. That's one of the most popular. It's widely used plate-based assay. It's common in laboratory diagnostic testing. We have your lateral flow assays, which are a basis for many point-of-care tests, and it's particularly used in urine drug testing. When you have a urine dipstick and you pee in a cup, then you have a lateral flow assay. This is a cornerstone of rapid testing. Other examples of lateral flow include COVID tests, the COVID test strips. When you have just the strip, you put the answers on there, and you see it flow through the system, and it gives you the 2 lines if it's positive. That's an example of a lateral flow, as well as a pregnancy test. Pregnancy test is a lateral flow assay. These are the types of things that are used for rapid testing, and they give you an idea of what steps to move forward. They're essential for quick and reliable results, and they can support diverse diagnostic applications. So remember, a immunoassay is a presumptive test. This needs to be followed up with confirmation. So the advantage of the immunoassay: they're rapid results. They deliver outcomes within minutes and essential for urgent care. The cost efficient. They are often affordable reagents, and the equipment needed to read them is often cheaper, so the overall cost is usually less. It allows for high throughput capacity. The processing more samples at once and suitable for large-scale testing. But like with anything, there are limitations. It is only a presumptive test, and presence or absence is indicated, but does not confirm specific self-inflicted, which means that there can be false positives. It does not specifically for it's only for class. So it can be the result may cause cross-reactivity from silver compound, and common medications can cause misleading results. And of course, there's lack of quantitation. Most tests are not fully quantitative, and they cannot determine the exact drug concentration. They are most likely semi-quantitative at best, and usually that is a greater than or less than capability. Because these tests are usually single-point assays, they cannot give a reliable quantitation. So some examples of urine drug screening for opioids. The purpose of this test is to detect the presence of an opioid family of substances in urine, and the test result interpretation to show a positive result if any opioid is present. Now this means there is a lack of specificity. You cannot distinguish between the different types of opioids. Because opioid drug screen test is going to focus in on morphine, so the target drug compound is going to be morphine. Now the reason for this is morphine is a metabolite of many other drugs. It is also the main structural compound of the class of opioids. Morphine is derived from the poppy plant. It's the original opiate actually. And many of the drugs are designed to be similar in structure to morphine. So that's chosen as the main compound as well as the metabolized. When we have heroin diacetylmorphine quickly metabolized down to 6-monoacetylmorphine, and then metabolize even further to morphine. Codeine also metabolized morphine. Hydromorphone is a drug on its own, but is very similar to morphine. And then hydrocodone, it's very similar to codeine, and it metabolizes down to hydromorphone. So they all have a similar structure to morphine. So morphine, codeine, and heroin will all yield positive results, which clinical applications means you need further testing to identify. So an opioid screen test could be morphine, could be codeine, could be heroin. It could be any of those drugs that are structurally similar to morphine. So once a screen is performed and you have an opioid positive screening, you need to have confirmation. As always, I want to harp on one last thing, and that's evidence integrity. Chain of custody is the single most critical component in legal admissibility. The chain of custody meticulous unbroken log of every person who's handled or examined the evidence. Any break in this chain compromises the entire case, rendering the evidence inadmissible in court. It doesn't matter how good the result is if the chain of custody is broken. If the blood sample, as it shows that there's a high person has 3 times the legal limit of ethanol, if the blood draw was obtained illegally or the chain of custody is broken, you cannot administrate that. You can't admit that evidence into the court of law, that it is useless. So it doesn't matter how valuable the evidence is, if it's obtained illegally, it's obtained without integrity, and if you lose the integrity of the evidence, you lose your chain of custody. I want to harp on that. The biggest thing is the goal of forensics is to make your evidence admissible in court. If you break that chain, you lose that chain, it's no longer admissible. Evidence is no longer admissible. Garbage in, garbage out. That is my motto, my saying. And that I will not take any questions. If you want to pop a question in, drop a question in the comments, post a question on our community page, anywhere on that is good. So hope you enjoyed this presentation, and we'll catch you guys later.